Welcome to Kaleida Medically Speaking and our special series on the fight against the coronavirus. As you can see, we have modified our format to practice safe social distancing while providing timely and factual updates from the Kaleida Health team during this public health crisis. We as a healthcare organization believe it's important for the Western New York community to hear from our medical experts who are leading the charge in our facilities and with our workforce of over 10,000 strong. I'm Mike Hughes, and this is Medically Speaking. Welcome to Medically Speaking. Our guest today is Dr. Mike Mineo, the Chief Medical Officer at Millard Fillmore Suburban Hospital and DeGraff Memorial Hospital. Dr. Mineo, thanks for joining us today.
Thank you for having me, Mike.
I realize you guys are busy at this time dealing with the coronavirus, in particular Suburban Hospital, which, as many people may not know, has really taken on a lot of the patient volume for those who are admitted with the coronavirus. So if you can, tell us a little bit about how Suburban's dealing with this.
We've been pretty busy. We attribute it to us having a very mobile patient population that tend to travel quite a bit. And because of that, we're in the forefront of managing COVID-19 in Western New York. So our teams have adapted really well to managing these patients. The emergency department volume isn't as much as we had expected in the earlier stages, but our ICU volume is. These patients that come in are quite sick and often require intensive care level of care. The ICU team has done a great job. We have 20 beds in our intensive care unit. We quickly filled those beds. We had created an additional intensive care unit in our post-operative units, and we are now having patients managed in that area.
So as part of your planning efforts, as we were hit with this, how much planning plays into your ability to manage this type of patient volume that comes in? The whole command center structure, disaster preparedness, how much does that come into play?
The planning worked out exceedingly well. So we initially planned to have 150% of our ICU capacity. So turning our 20-bed ICU into a 30-bed ICU. Last Thursday, we made sure we had the beds placed, made sure we had the right pharmacy in those additional area, and did a dry run. Now realizing we'd actually need it the next day. So when we had to activate it that Friday, it was seamless because we had planned it, we drilled it, and we just put the plan into action.
So when you talk about that planning, some of the things that you guys have accomplished, restriction on visitors, hand hygiene, social distancing, taking temperatures, and masking all employees and visitors, those who are allowed in as they come in and out of the building. Even, I see now the tents are up outside the emergency room should, there be a larger surge. The preparedness and really trying to limit the amount of traffic in the hospitals. Has that helped?
We like to think it has. This is a disease that is not best managed with medications, but by social precautions. It's by making sure that the patients that enter the building and the staff that enter the building don't have signs of infection. So we're very careful to screen everybody, and we know a lot of transmission is before people have symptoms. So we put a mask on everybody who's in this building the minute they walk into the door.
And it's not just the coronavirus patients that you guys are taking on right now. I mean, obviously your emergency room is open. You're doing surgeries that are deemed necessary. Moms, if they're expecting to have a baby. So can you tell us a little bit about what the hospital is doing for its normal business?
So as much as the focus is on coronavirus, people are still getting ill from every condition. We still have patients coming in with kidney stones, acute appendicitis. So we are managing those patients the way we typically would, with the exception that we're trying to protect them to make sure they don't contract COVID from either staff, from the physicians, or from other patients that may be in the building, which is why we're so rigorous with screening at the door and using appropriate precautions throughout the process. People are continuing to give birth to children, so we're doing all we can to protect both the mothers, the fathers, and the babies.
So let's talk about the emergency room kind of as the entryway for this virus. You're an emergency room trained physician. You've seen everything from H1N1 to bad flu seasons, SARS, Ebola. How important is it for the frontline staff, the emergency room nurses and docs, to be prepared for this? And why have you guys made that such a focus?
The emergency department is unique because we're used to conditions like this. You mentioned influenza season H1N1. So preparing for an influx of infectious disease is really not that unusual from our training. And it's excellent because our staff is responding very well and is often a source of strength for some of the other departments that will look to the ED having had experience managing this.
So, but is it true that, some ER volumes across Western New York, not just say at your hospital, but, the Catholics and ECMC and even some of the hospitals downtown, the ER volumes are down a little bit because people are thinking twice about that unnecessary visit, or primary care docs are doing a better job of communicating with their patients at this time?
The ED volume is down across the system, and I think that you nicely explained why that's occurring. Normally, when a patient calls their primary care office, the primary care physician often is full of appointments and may not have room to see them, so they come to the emergency department. The primary physician community is really stepping up and making sure they're providing access to their sick patients to keep them out of the hospital as much as possible. And we think that patients are doing some triage of their own and staying away from the emergency department unless they absolutely need to be here. One of our concerns, though, is making sure that appropriate patients that need to be here do actually come and seek the care that they need.
And you mentioned triage. So as part of that planning of the expansion of the emergency department over the next couple of weeks, should the surge occur, I know that the tent is out there, but if you would change the way the current emergency room operates or flows. Tell us a little bit about that.
So our plan is to take the initial screening portion and bring it outside the building. So we have a heated tent outside, and the plan is to have patients come there and have them quickly screened. Patients that we are concerned may have COVID but do not look very ill, the hope is that just to treat them in that area and prevent them from coming into the building to minimize exposure to our other patients. This also would open up our current waiting room as more treatment-based, with the understanding that as the hospital gets overfilled, we may be using that as actual treatment areas.
Gotcha. So, Doc, as we wrap up, if you can, you mentioned some of the intensivists. We've talked about the nurses, the docs. If you can, a message to the workforce there for all the work that they've done over the last 30 days. It's been a very, very busy, hectic, stressful time. So any type of message you'd want to give to the staff there?
We know these are anxiety-producing times. The fear of the unknown is worse than knowing an actual problem. Our staff has really stepped up. They're picking up extra shifts in the ER and the ICU. They're putting themselves and their families at risk to make sure they're here to manage and care for our community. So we want to give a message of gratitude for what they're doing for our patients and for our community.
Well, Doc, I know you guys are busy. We don't want to take up too much of your time. Thanks for joining us today on Medically Speaking.
Thank you for having me, Mike.